Hi there. In this video, I will explain the topic regarding understanding and communicating test result. Giving tests and interpreting them with psychometric rigor is indeed a highly technical skill requiring years of formal training to learn and many more years of sustained effort to master. Nevertheless, the true artistry of our profession as psychologists is to communicate so effectively, so naturally, and so movingly that our technical skills are noticed only as an afterthought, if at all. So today we will start with the understanding of assessment process. The assessment process must be data-driven at its core, but it needs narrative bookends to give it purpose and persuasive power. As depicted here, the process proceeds in three distinct phases. First, listen to people. The assessment process begins with careful attention to the referral concerns and narratives of people's lives. Using active, empathic listening skills, the examiner continuously communicates with interviewees, clarifying misunderstandings as they occur. At some point, the examiner, the examinee, and other interviewees come to a consensus that the examiner understands the referral concerns sufficiently to proceed to the formal data gathering phase. The second phase is learn from data. The examiner attempts to learn additional information and answer referral questions using structured observation, rating scales, and direct testing. Guided by current theory and supported by the best available psychometric models, the examiner infuses the narratives learned in the interviews with data-driven insights from observation and testing. So here it is, the third phase. Retell the story. The examiner takes the updated data-driven case formulation and makes it persuasive and easy to understand by translating it back into narrative form. Skillfully retelling an empathy-inducing narrative provides the reader with satisfying explanation of the referral concerns and inspires the reader to take productive action. Ideally, as a psychologist, you listen closely to your referrers and help them articulate a clear set of referral questions that can be meaningfully answered by the assessment. Then, you generate a list of possible hypotheses from which you create a flexible assessment plan to evaluate those hypotheses. As new data and observations are gathered, you evaluate your hypothesis as you go. Often hypotheses need to be revised and defined, prompting further rounds of planning, testing, and hypothesis evaluation until plausible explanations for the referral question are found and you can update your case formulation. After finishing the assessment process, specifically with the psychological testing, you need to report the scores. Report scores in a way that communicates directly, without jargon, and without attempting to impress the reader with your level of sophistication. In some situations, it is appropriate to write a few sentences to explain the meaning of the reported scores. So we will try to understand the type of scores. The first one is row scores. Row scores are the number of points assigned for a test scale. For example, on some tests, the row score is the number of questions answered correctly. The meaning of row score points depends on how difficult the questions are for people at different ages. To make row scores easy to understand, they are transformed to more interpretable scores like percentile ranks. Usually, there is no need to present row scores in a report. However, in rare cases, an examinee's performance appears not only to be declining relative to some age peers, but also compared to past performance in an absolute sense. If the decline is evident in many tests, it is important to distinguish between low effort and more serious problems that cause global deficits, such as dementia. We'll continue to the next. It is standard scores. The term standard score refers to any kind of z-score transformation. When row scores are converted to z-scores by subtracting the mean and dividing by the standard deviation. Confusingly, this term is often used to refer specifically either to z-scores or to the index score metric with a mean of 100 and standard deviation of 15. The term scaled score also sometimes refers to a kind of z-score transformation, but here refers to the metric in which the mean is 10 and the standard deviation is 3. Over half of the population obtains a score between 8 and 12. Over 95% of scaled scores are between 4 and 16. Because tests provide different types of standard scores, the wide range of means and standard deviations can be confusing to readers. Most standardized tests yield scores with a mean of 100 and standard deviation of 15. Others have a mean of 50 and a standard deviation of 10. In addition, on many tests, the factors have a mean of 100 and a standard deviation of 15, but the subtests have a scaled score of 10 with a standard deviation of 3. You may take a look while in this normal curve. Z-score scale has a mean of 0, as I mentioned before in the previous slide. About 68% of z-scores are between -1 and 1, and about 95% of z-scores fall between -2 and 2. And about the t-score, t-score is the average of t-score is 50. Over 2/3 of t-scores are between 40 and 60. Over 95% of t-scores are between 30 and 70. In this image, you can also see what is called standard 9 or stay 9s. The stay 9s range from 1 to 9. Scores of 1 to 3 are low, 4 to 6 are average, and 7 to 9 are high. Most people, professionals and laypersons alike, find that percentile ranks are the most understandable metric. You should communicate findings using percentile ranks, but you should think and reason about test scores in terms of standard scores. Standard scores have a linear relationship with the underlying latent scores. Almost every kind of calculation, contrast, and prediction must be done with standard scores, not with percentile rank. The percentile rank is the percentage of people, the examinee's age, who have the examinee's score or lower on this test. It doesn't refer to the percentage of questions that were correct. You must remember this. So here is the example. Araceli's score was at the 75th percentile. It will be incorrect if you understand that Araceli answered 75% of the items correctly. But it is correct when you understand that Araceli scored higher than 75 of age mates in the normative samples. Yeah, sometimes people confuse percentile rank with the percentage correct. In example, thinking that 70th percentile means 70% correct. Thus, be careful to explain that a score in the 75th percentile means that the person did better than 75% of the normative group, not that the examinee got 75% correct. Should we continue to the next is the range labels. In addition to the standard score, confidence interval, and percentile rank, descriptive categories are also useful. One way to simplify the task of interpreting standard scores is to give descriptive labels to numbers. The descriptive categories vary greatly according to each test, so be careful to apply the correct category according to the test that you are using. Many professionals use unified label system for all scores in their reports. For example, using the neutral terms low, average, and high, with the intensifiers very and extremely. Well, specific example by using the Wechsler scales. The Wechsler scales use categories of very superior to extremely low, whereas many of the Kaufman instruments use categories of well below average to well above average or lower extreme to upper extreme. These facts supported my explanation before that the descriptive categories vary greatly according to each test. This is the descriptive categories for Binet test. In the report writing, sometimes report writers place scores within the interpretive section of the report, making it easy for the reader to associate the interpretation with the obtained test scores. For example, the report writers may write as follows. You may select a level of confidence from a 68% to 99%. The choice is based upon how confident you want to be. A more stringent level of confidence leads to a wider confidence interval. In many instances, psychologists choose to report intelligence quotient scores with a 90% level of confidence, whereas in others, such as achievement test results, the 68% level is deemed sufficient. The other terms that are often used in the test report are age equivalent score and grade equivalent score. An age equivalent score is the age at which most people obtain the examinee score. For example, an age equivalent score of 4 means that the examinee obtained the same score as the average 4 years old. A grade equivalent score is the grade level at which most students obtain the examinee score. For example, a grade equivalent of 5.5 means that the examinee obtained the same score as the average student halfway through the 5th grade. Okay, we'll continue to talk about the test result and interpretation. Tests are among the most important assessment tools we have. However, rarely can trustworthy interpretations be made from a single test score or even multiple converging test scores. For example, you would not hypothesize that a child has a poor visual motor integration based solely on a low score of a visual motor integration test. Even if the child scores poorly on two-shots test, there needs to be at least some parallel evidence from outside the testing environment. So you need to configuring the scores from the various tests administered and also combine it with the behavioral observations result both during the test and in other contexts, outside the testing environment. And then you need to learn about the history and other information from various backgrounds, including scores earned on tests administered previously. Here are the most common errors that have been found to be regarding to the testing procedures that you need to figure out, and then Please manage yourself when doing the psychological testing. You are not doing these mistakes, so the test scores will be valid and variable, and then you can use it as the data to write the report. You should notice that the test score plays a supporting role rather than taking center stage in the narrative of the report, but still the test scores is very important to help you describing the examinee or your client, yeah, and to get the further understanding to build the case formulation. The case formulation will be very important for you to conduct the later process, yeah, such as the diagnosis, and then help you to plan the appropriate intervention for the client. Okay, we've learned a lot today, starting with understanding the assessment procedures and then discussing about the scores and how to understand it, and then how to write it in the report, and then lastly I give you some tips to avoid errors in the testing. And so this is the end of these videos. Thank you for watching, and this is the references that I used to gain the data and also information that I provide in the video. Okay, thank you again, and see you in the other learning materials. Bye.